So in my assessment of the patient, I'm going to be looking at how their jaw opens. So I'm going to be feeling on their TMJ joint, and that's kind of if you go below that zygomatic arch, and you feel right in there. So I'm going to have the patient open their jaw. Mine is fairly straight. However, if somebody had TMD, oftentimes I will see one of two things. Either I will see them open and at the end they'll come into kind of a J open. And then what I'm feeling with that is a hypermobility on this side where it kind of pops into my fingers, and then a restriction on this side where there's not quite as much movement. So now as the patient opens, you can feel that roll, you can feel that glide, you can feel it pop in your hand. That's going to tell you what's going on each side. The other thing that you might see is kind of what I call a shaky open, where the patient is going to kind of wiggle their way up and down, and you can feel that in the joint, you can feel that throughout. So this might be caused by muscle control. It could be that there's arthritis in those joints that's kind of making it catch. It could be a number of different things, but those are a couple of things that you're going to see, what you should be able to feel, and what you're feeling is going to kind of direct the interventions that you're performing with your patient.